The name Dr. David Minkoff might not be familiar to everyone, but within the world of alternative medicine and the controversial Church of Scientology, it carries significant weight. Minkoff, a longtime Scientologist, has built a career around alternative treatments, often catering to fellow members of the faith. However, his name has also been linked to tragedy, most recently in the wrongful death lawsuit filed by the mother of Whitney Mills, a young Scientologist who died by suicide. This case has once again brought Minkoff and the Church's stance on mental health into the harsh glare of public scrutiny, raising uncomfortable questions about the intersection of faith, medicine, and the limits of alternative treatments. Dr. David Minkoff's journey into the world of alternative medicine began long before his name became entangled in controversy. A graduate of the University of Wisconsin Medical School, Minkoff initially practiced traditional medicine. However, his path took a turn as he became increasingly disillusioned with conventional approaches to healthcare. This disillusionment led him to explore alternative modalities, eventually becoming a proponent of treatments often shunned by mainstream medicine. Minkoff's embrace of alternative medicine coincided with his involvement in the Church of Scientology. A vocal advocate for the Church and a major donor, Minkoff's medical practice often reflected Scientology's own skeptical views on traditional psychiatry and mental health treatments. This intersection of Minkoff's medical beliefs and his faith would eventually have devastating consequences, first coming to light with the tragic case of Lisa McPherson in 1995. The death of Lisa McPherson, a Scientologist who died while under the care of the Church, sent shockwaves through the organization. Her tragic demise not only affected those who knew her personally but also reverberated through the wider community, raising alarms and questions about the Church's practices and its approach to mental health care. The incident brought intense scrutiny onto its practices, particularly its stance on mental health. The media coverage was relentless, with headlines questioning the Church's methods and the safety of its members. People across the nation were suddenly aware of the potential dangers lurking within the organization. McPherson, who had a history of mental health struggles, suffered a mental breakdown and was taken to a Scientology-run hotel for care. This hotel, known as the Fort Harrison Hotel, was supposed to be a sanctuary for her recovery. However, it became the site of her ultimate decline. It was during this time that Dr. David Minkoff, a licensed physician and a Scientologist himself, was consulted. He provided medical advice and prescriptions without ever directly examining McPherson. This remote consultation raised ethical concerns and highlighted the potential risks of such practices. McPherson's condition deteriorated rapidly. Despite the Church's assurances that she was receiving the best care possible, her health continued to decline. After 17 days under the Church's care, she was pronounced dead. The news of her death sent shockwaves through the community and beyond. The subsequent autopsy revealed severe dehydration and malnutrition, raising serious questions about the care she received. The findings were damning and suggested that McPherson had been neglected during her stay at the hotel. This revelation fueled public outrage and led to calls for accountability. While Dr. Minkoff was not charged criminally, he faced disciplinary action from the medical board. The board's investigation concluded that his actions were unprofessional and negligent, resulting in the suspension of his medical license for a year. This decision was a significant blow to his career and reputation. The McPherson case served as a chilling prelude to the controversies that would later engulf Minkoff and the Church. It highlighted the potential dangers of unregulated care within religious organizations and sparked a broader conversation about the need for oversight and accountability. The case remains a poignant reminder of the tragic consequences that can arise when vulnerable individuals are not given the proper care and attention they deserve. In 2022, tragedy struck again, this time claiming the life of Whitney Mills, a young Scientologist. Whitney was a vibrant young woman, full of dreams and aspirations, who had her whole life ahead of her. She was known for her kindness, her dedication to her community, and her unwavering faith. But beneath her bright exterior, Whitney was struggling with deep-seated mental health issues that she felt she couldn't openly discuss. Like Lisa McPherson before her, Whitney sought help and support within her community. She turned to Dr. Minkoff, a practitioner known for his alternative approaches to treatment. Whitney placed her trust in him, hoping that his methods would provide the relief she so desperately needed. Dr. Minkoff's reputation for treating complex cases with unconventional methods gave Whitney a glimmer of hope in her darkest times. However, according to the lawsuit filed by Mills's mother, instead of receiving proper mental health care, Whitney was subjected to a battery of alternative treatments. These treatments included being diagnosed with Lyme disease, parasites, and even ovarian cancer, all without proper medical justification. The lawsuit alleges that these misdiagnoses and the subsequent treatments not only failed to address Whitney's mental health issues, but also exacerbated her condition. The treatments Whitney received were not only unconventional but also highly controversial. The diagnosis of Lyme disease, for instance, was made without the necessary medical tests and evidence. Similarly, the diagnosis of ovarian cancer was based on dubious criteria, leading to unnecessary stress and anxiety for Whitney. These misdiagnoses diverted attention from her actual mental health needs, leaving her feeling more isolated and desperate. On May 13, 2022, Whitney Mills took her own life, leaving behind a grieving family and a storm of controversy surrounding her death. Her passing was a devastating blow to her family, friends, and the community that had watched her grow up. The pain of her loss was compounded by the questions and doubts surrounding the care she received in her final months. Her mother's lawsuit alleges that Dr. Minkoff's misdiagnosis and his failure to address Whitney's deteriorating mental health were direct contributors to her suicide. The lawsuit claims that the treatments Whitney received were not only ineffective but also harmful, leading to a rapid decline in her mental state. It further alleges that Dr. Minkoff's approach was negligent and that he failed to provide the standard of care that Whitney needed. The suit further claims that the Church of Scientology bears responsibility, alleging that its staunch opposition to traditional mental health care prevented Whitney from seeking the help she desperately needed. The Church's teachings and practices, which discourage the use of psychiatric treatments, are cited as a significant factor in Whitney's inability to receive appropriate care. The lawsuit argues that the Church's influence created an environment where Whitney felt she had no viable options for addressing her mental health struggles. Whitney's tragic story has sparked a broader conversation about the role of alternative treatments and the responsibilities of religious organizations in the mental health care of their members. It raises critical questions about the balance between faith, alternative medicine, and the necessity of evidence-based medical practices. As her family seeks justice, they hope that Whitney's story will lead to greater awareness and changes that could prevent similar tragedies in the future. Section 5. Scientology's approach to mental health, a rejection of traditional psychiatry. To understand the allegations against Minkoff and the Church of Scientology in the death of Whitney Mills, one must first grasp the organization's controversial stance on mental health. Scientology's approach to mental health is deeply rooted in its foundational beliefs and practices, which starkly contrast with mainstream psychiatry. Scientology, founded by science fiction writer L. Ron Hubbard, views psychiatry as a barbaric and corrupt practice. This perspective is not just a minor aspect of the religion but a core tenet that influences many of its teachings and practices. Hubbard, who had no formal training in mental health, believed that mental illness was a fabrication and that traditional treatments, including psychiatric medications, were harmful and designed to control individuals. He argued that these treatments were part of a broader conspiracy to suppress human potential and freedom. In place of traditional psychiatry, Scientology offers its own brand of mental health care, rooted in Hubbard's teachings and practices like auditing, which involves using an e-meter to supposedly identify and address spiritual and emotional blockages. Auditing is a central practice in Scientology, where individuals are guided through sessions to confront and clear past traumas, which are believed to hinder their spiritual progress. Scientologists are strongly discouraged, often even prohibited from seeking help from psychiatrists or taking psychiatric medications. This prohibition extends to all forms of psychiatric intervention, including therapy and counseling, that are not aligned with Scientology's methods. This stance, critics argue, creates a dangerous environment where individuals struggling with genuine mental health issues are denied access to potentially life-saving treatments. Critics of Scientology's approach to mental health argue that the organization's rigid stance against psychiatry can lead to tragic outcomes, as individuals may not receive the care they need in times of crisis. The controversy surrounding Scientology's rejection of traditional psychiatry is not new. Over the years, numerous cases have emerged where individuals within the church have suffered due to the lack of appropriate mental health care. These cases have fueled ongoing debates about the ethical responsibilities of religious organizations in providing or restricting access to medical care. Despite the criticism, Scientology remains steadfast in its beliefs. The church argues that its methods are effective and that traditional psychiatry is fundamentally flawed. They claim that their approach empowers individuals to take control of their own mental health without the need for medication or conventional therapy. As the debate continues, the impact of Scientology's stance on mental health remains a contentious issue. For those within the church, the rejection of traditional psychiatry is seen as a path to true spiritual freedom. For critics, it represents a dangerous denial of essential medical care. The story of Whitney Mills is a poignant reminder of the real-world consequences of these deeply held beliefs. In the end, the clash between Scientology and traditional psychiatry is more than just a difference of opinion. It is a profound conflict over the nature of mental health, the role of medical intervention, and the boundaries of religious freedom. This ongoing debate challenges us to consider how we balance individual beliefs with the collective need for effective mental health care. As society continues to evolve, the conversation around mental health and the role of organizations like Scientology will undoubtedly persist. It is a dialogue that requires empathy, understanding, and a commitment to ensuring that all individuals have access to the care they need, regardless of their beliefs. Ultimately, the goal should be to create a world where mental health care is accessible, compassionate, and respectful of diverse perspectives. Only then can we hope to address the complex and multifaceted challenges of mental health in a way that honors both individual autonomy and collective well-being. Could it be that some patients are being misdiagnosed? Are there cases where exploitation is taking place under the guise of treatment? These are questions that demand answers. Throughout history, there has been a constant clash of medical philosophies. Traditional practices often stand in stark contrast to modern medical approaches. This clash can sometimes lead to confusion and mistrust among patients. Alternative medicine, while offering hope to many, often exists under a shadow of controversy. Some claim remarkable benefits, while others warn of potential dangers. The debate continues, leaving many to wonder where the truth lies. In light of these issues, there is a clear call for greater scrutiny. More importantly, there is a heartfelt plea for help from those caught in the crossfire of these medical debates. It is crucial that we listen and respond with empathy and understanding.